So hospice nurses struggle with bag technique. I think across the board, that's one of the #1 struggles that we see with hospice nurses. I had that same issue. My name's Shelley Henry. I've been doing hospice for 24 years. I've worked on the nursing side, the compliance side, the clinical side of hospice. When I'm in the field, struggling with my bag was one of the biggest struggles I had. First of all, how do we do the proper bag technique? Where do we set it down? Because I would tell you what, in this day and age, I'm not setting my bag down anywhere. And so this is where we came up with the design for the tag bag. So I actually built the first one for myself. It's a wearable bag. You wear it either as a hip bag or a crossbody bag. Super comfortable. I also learned something very interesting is you don't need to carry every single thing from your trunk in your bag. So in the tag bag, we put in this main compartment here just the things that we need for our hospice visit. And then I have a little zipper part in the front to put some little special things, but best part, hand sanitizer on the outside. Super easy to use every time before you enter your bag, following good bag technique. I have gloves on the outside, so because you know we're in the home by ourselves, sometimes we got to grab our gloves. It's very easy to get to our gloves. I put a safety light here that can be used if you're working late at night to light your pathway, used in dark houses. You can actually remove it too, and I use it for procedures sometimes for different things. And then we just stick it back here. But the best part is the tablet slot right here. My little padded tablet slot holds this size tablet and up to your larger tablets safely and securely in there right next to me all day long. So the tag bag is the perfect bag for anybody who provides care in the home. Here's a few pro tips to consider when you're using it in the field. I put all of my equipment in this main part. So my blood pressure cuff, pulse ox, thermometer, only those things that I use to check vital signs do I put in this main part. I also use the dental bibs or the little barriers in there. I'll put one in there for every patient that I'm going to see. So if I'm just going in to see one patient, I have one little bib and a hand wipe. So I take that out and I open it up during the visit, and that is what I use to wipe down my equipment before. I find it very easy to use since you don't have to put the bag down because you're wearing it. You don't need the big bag barrier. In the zipper part, this is where I'm going to keep things that I want to keep nice and neat. Like I'll keep my 2x2s and 4x4s in here. I'll keep tape in here. I keep my CPR mask in here, alcohol swabs, those kind of things I keep in here. I don't put them in the main compartment because I save the main compartment just for my equipment. I find it keeps it much neater and it's much cleaner whenever I'm out in the field working. On this side here is where I'm going to put my pens. So I may have my reading glasses there. I like to keep a black marker with me in case we have to mark on wounds or anything like that. I keep all of that on this side. And the best thing about the tag bag is you can wash it. So it's machine washable. I usually wash mine and then hang it up to dry. So if you are interested in learning more about the tag bag or getting one for yourself, click the link below, go to our website, you can purchase them there. If you have any questions, you can leave a comment below and I'll answer them, or you can ask a question on our website or even give us a call. You'll find our phone number. Click the link below. Thank you.